Well, good morning, everyone, and welcome to another edition of the morning show right here on Main Street TV. And of course, Jennifer here to start off your morning with some very special guests here in the house this morning. And you know why they're special? Because they're very special girls, but they also brought donuts from the treatery. So thank you.
You're welcome.
They know the way to our hearts. There they are. And they are from Wise Medical Home Care. So that's so cute. They decorated them with your logos and everything. How cute. All right. So, welcome to the program. We're so glad to have you all here. So first off, let's go around the table and introduce yourselves.
Sure. Hi, everyone. I'm Missy Radune. I am the Quality Assurance Nurse with Wise Medical Home Care.
I am Lisa Zink, and I'm the Executive Assistant for Wise Medical Home Care.
Hello, everyone. I am Laura Ireland, and I am the CEO and Administrator for Wise Medical Home Health.
Very good. So we have some big cheeses in the house today. This is exciting stuff. So Wise Medical Home Care, tell us where you're based, and then we'll go from there as to what services you offer and that kind of stuff.
Our corporate office, our main office is in Chillicothe, Ohio. We recently just bought a brand new building, and it is absolutely beautiful. It's over beside Lowe's on It's 6 Health Drive. Yes.
Health Drive. I love that.
Yes.
So good.
And that is our main office. We do provide services, though, in multiple counties. We service 8 different counties for nursing and therapy services. So we are in, let's see if I can remember all of them.
This is a test.
It is a test.
We are in Fayette, which is the Washington Courthouse area.
I have a cheat sheet. So
yeah, I do too, but let's see if I have to look at it. Check. Yep. We are in Ross County. Of course, that's Chillicothe area.
Yep.
We are in Pickaway County, Circleville area. Mm-hmm. We are in Pike County, Vinton County, Jackson County, Scioto County, and Lawrence County, all the way down in South Point area. How'd I do, ladies?
She did pretty darn good, I will say. Like, you know what you're doing or something.
I hope so.
We hope so, too.
Yeah, right? Yeah. No, we're so happy to have you here today. And let's talk for a minute about home care. And, because we were talking off the air and, there's obviously home care through like, a doctor's referral or something like that. But then there's also private home care. So could you guys just touch on some of the different areas in which you can provide care for folks?
Sure. We get a lot of our referrals from doctor's offices, hospitals, but we also take self-referrals. So if a patient feels like they need assistance, but they're not quite sure what they would qualify for, we'll actually go out and do a free evaluation and see what services that they may qualify for. So all they need to do is contact the office if they need that. We'll take care of, once we do the home evaluation, contacting their doctor, getting all the documentation, getting the order. So we do have a lot of self-referrals or referrals from family members as well.
Very good. And Lisa, is that where you come in?
That's where I come in.
She's so cute. She's my neighbor, just to let y'all know.
We're neighbors. We share a dog.
We share a dog. It hurts her feelings because her dog always wants to come to my house. So.
Always.
But at least she knows where to find her.
Yes. Just middle of the night, I come over and get her.
You're like,
she
it's
can
my
stay
turn.
till the morning. It's fine.
She's having a sleepover.
Yeah. It's okay.
Shared parenting.
Right.
Yes.
Yeah. Right.
But no, so if you call the office, you'll probably talk to Lisa, right?
Absolutely. You can call the office at 740-775-4108, and I'm at extension 205. You can also reach me by email at lzink@wisemedicalstaffing.com. And then you just can start out by giving me some information and we will take it from there.
Yeah, that's right. So let's talk for a minute about, what are some of the advantages of home health care? And I think that it's such an advantage because it gets people where they don't have to leave their home. We're all more comfortable at home. So I assume that that's such a gift for folks when you guys can come to them.
That is definitely our goal, and that is what we pride ourselves in, is working with the physicians and working with their physician and their, whether that's their primary care physician, whether that's a surgeon, whether that's their cardiologist, the dialysis center, the wound center, whoever that is. We have contacts and work with all different types of specialties.
Okay.
So our goal is to then come into the home, and we can provide a variety of services such as education. So if we've got somebody that's a new diabetic and they're just not quite sure, what they're supposed to be eating, if they're on insulin, what how to give the insulin, the range that they're supposed to have. Education. So we go in and we provide a lot of education, hands-on education. We also can do, we have lots of things we can do, such as blood draws in the home. So that will keep the patient from having to go out and go to the lab. If we've got somebody that just was recently put on a blood thinner that has to take medication and they have to have their levels checked every week. And then if those levels are not within normal range and they need rechecked and medication adjustments. So we work really close with the physician's office to make sure that that patient understands those changes, and we're able to help them with their medications and medication management and teaching to help prevent a rehospitalization. So that is our goal.
And that is so nice to hear because, and I am not knocking anybody, but, hospitals are charged with getting you better and releasing you. Well, sometimes there's actually a lot of time, there's this breakdown between, okay, well, we got you fixed up, go home, and what you do then.
And a lot of times, too, when you're in the hospital, you're not on your best learning atmosphere.
You feel like crap. Let's
So
just be honest.
we're able to go in where they are safe, where they are comfortable, surrounded by the people that they're comfortable with.
Yeah.
And, they may not have heard everything about that cancer diagnosis.
Correct.
So we can sit down with them and explain it. We take as much time as we need to with these patients to make them be comfortable, to let them understand what's going on. So we're family. We're not just a nurse going in. We have excellent nurses that provide excellent care. Our therapy staff is amazing. And, we had a lady that one of our nurses took one of our patients treatery donuts a couple weeks ago. So, we do little special things to make them feel special. And that's why we love what we do.
Yeah, because, and I think that's great because you do become family. You're spending a lot of time with these folks and you can't help but.
Yeah.
But, like diabetes is a huge one. I'm sure like people get this diabetes diagnosis and they've probably been in the hospital because they haven't been feeling well because they didn't know. And you go home and it's like, well, you need to eat right and you need to check your insulin and you need to do this. And they're like, I don't.
Right.
I don't know what that means.
I don't know. Yeah. I mean, I don't know.
And and typically what will happen in the hospital, because they want to get home back to their safe place, they'll act like they understand. Although, like, okay, I don't have any questions.
Anything.
Just let me go home.
You'll say anything to get out of there.
Yeah. So then when we get that referral and we're able to go into the home, then we can work with them one-on-one.
Yes.
And another important thing to remember, a lot of patients are concerned about cost. So home health, what that is billed through your insurance. So Medicare pays 100%. Medicaid pays 100%. We have patients that are through the VA. We work with the VA a lot, and we can get authorization through the VA. So most of the time, those services are all 100% paid through your insurance. So there's not an out-of-pocket expense for you. So that's something I definitely wanted to share, is that's a concern sometimes about expense.
Sure.
So
because you hear home health, someone coming to you, that's going to cost.
Right.
Yes. Lisa works behind the scenes with a lot of the insurance companies and sends in authorization. So there's a lot of pieces behind the scenes that we take care of to ensure that that patient gets the services that they need, and that they're not having any cost out of pocket. We also work with When we go into the home, we see that not just the patient, but we look at their environment. Is it safe for them to be in? Do they need
Get rid of the rugs.
Yes, get rid of the throw rugs.
Number one, get rid of the rugs.
Do they need equipment? Do they need a shower chair? Do they need a hospital bed? Do they need a new walker? They borrowed a walker from a neighbor that's
Sally's
75
cousin.
years old and it's wheels missing, So we look at all of those pieces. We look in their fridge. Do they have food? Do they have enough money to get their medications? Do they have to choose between buying medications and buying food? So we have a variety of resources and people that we work with to treat that patient as a whole and to make sure that they have the best chance of success of staying in their home, because that is our goal. Our ultimate goal is to keep them in the home as long as possible. The physicians we work with are amazing. They trust us. We've built up a really good rapport with the physicians, and they know if we call them when we say our patient is, they've had some 3-pound weight gain and they've got some edema today, and this patient has congestive heart failure. Can we go ahead and get an order for an extra Lasix? And they trust us enough to say, yeah, if that's what you feel like they need, then yes, I'll give you an order for that. That just saved the patient a trip to the doctor, possibly a trip to the hospital. So those are kind of some of the things we do. We also can do IV antibiotics in the home. So if a patient needs IV antibiotics for an infection, they come home with a PICC line. We are trained in PICC lines and IV administration. Wound vacs, wound care. We can even do in-home chemo treatments. So we work with the cancer centers, and we can hook up and we can disconnect chemotherapy. So there's a lot of services that we can do. We have an extensive orthopedic background and very knowledgeable of post-op orthopedic surgeries, so joint implants. That's one of my favorites. I worked in surgery for many years. So we have a lot of knowledge of, post-op implants and knee replacements and joint replacements. And our therapists come in and get those patients seen right away and get them back to their baseline.
Great. And, those patients can, that's just one of those things where you shouldn't have to get in the car and drive somewhere when you just aren't feeling up to it and stress everything out, when someone can come to you and do the therapy and whatever. And in no time you're back to normal, but it's just so nice to not have to worry about getting in the vehicle. And a lot of times people don't have rides.
Exactly.
That's a whole other thing.
Exactly.
And we will help to arrange for transportation for patients if they need that as well. So we have resources and contacts for that also.
See, Lisa she's on it.
She is. She is on it.
We would be lost without our Lisa.
Thank you.
We have a great team. Every person on our team is very detailed, and the patient is their number one priority, and it's very evident. Our entire team takes pride in what we do, for sure.
Love that.
Yeah.
Love that.
Yeah.
All right. Well, let's talk for a minute about, I know we've touched on some, but let's talk for a minute about some of the services that you offer that people may or may not know about. And, again, how they get a hold of you and because, I think when you're in the hospital, do you not have a choice as to who you want? So don't let someone tell you that you don't have a choice. Correct?
Yes.
Okay.
Yeah. So typically, if you're in a hospital that hospital has a home health services, of course they're going to try to push their own home health, but absolutely the patient has the right to choose what agency that they want services provided through. So, even though...
So don't be pressured.
Don't be pressured, yes.
Make the wise choice.
That's
Choose
right.
wise.
Choice.
Exactly.
I love it. Pun intended all the way.
That was good, Missy.
Thank you.
I was saving
Absolutely.
that for the right time.
Good.
But no, that is very funny. All right. So some of the services that you all offer that maybe people might not know about even.
We do a lot of med setups for patients.
Okay, explain.
That a patient has dementia and can't remember when to take their medicines or what medicines to take at what time.
Gotcha.
So we
well,
will-
listen, even if you don't have dementia,
Exactly.
that's hard.
Exactly. Yes.
It's really hard.
Yes.
I mean, my dog's on a bunch of medicine, and I can't even keep track of hers.
Right. So we'll go in and put them in a med box. We have some patients that have med boxes that actually talks to them
Mm-hmm.
and says it is 9:30. Please
Time to
take
take
your
your
morning
medicine.
medicines. Yes.
What?
Yes. It's awesome.
That is so cool.
And if they don't, that company will call me and
Mhm.
say,
So and so,
so-and-so
Mr. Messon.
Yes.
Please contact them. So we went. Yes.
Yes.
I love
Yeah.
that.
Yeah.
So good.
Yeah.
Yeah.
So I mean that's one thing that we do a lot. And provide education about the medications. You know, they may say, "Oh yeah, I take that white pill that's
But has no-
round,"
Correct.
but I
But
don't
you have
know.
no idea what it is.
And then they get really confused when they go to the pharmacy to pick it up, and it's from a different company, and it's blue now.
And
Yeah.
And you know, they totally get
sure. And
all whopper jawed.
yeah, no, and I can totally see that because, at some point you just get, when you're taking 10 or 12 pills at a time, you're just like, I don't know what all it is. I just take it because that's what someone told me to do.
Exactly.
And we provide emotional support, spiritual support. I mean, I have prayed with patients. We
Aw,
have contacted
so
churches
good.
to come in to give communion to patients. We have nurses that will go out and buy groceries for their patients, go cook them meals taken to them.
Mhm.
They may not have clothes, go buy clothes.
Aw.
So we really do look at everything. We're not just trying to make them medically better. We want the whole picture to be better for this patient when we leave their home.
This is so
Absolutely,
good.
absolutely.
You
We were
girls are
able to-
awesome.
We even like to be in the community. So we were able to, a couple Christmases ago, we were allowed to go in a local assisted living and or nursing home.
Mhm.
And they allowed us to come in and Missy and I dressed up in our Christmas attire.
Yes, I was an elf.
Yes. And we had a little Christmas hats on, and we got to take stockings in and to the residents that didn't have family. We
Aw,
asked
that's so
for
cute.
Yeah, they gave us a list of people that they knew would not get anything for Christmas.
yes,
So our group got together.
Yep.
Every person got a package
Yep.
of stuff that they liked: puzzle books, crayons,
Yep.
coloring books.
house slippers, whatever
We
was their
did
thing that they
homemade
wanted.
candy and cookies, and we were able to go into the room and give them
Well,
to
you
the
guys
residents.
just come hang at my house? Sure.
It was great.
Yeah.
It
No,
was
that's
great.
This is all
So
pre-COVID.
cool.
Yes,
Yeah, right.
yes.
I know. I
Yes.
know.
Yeah.
Well,
Which
that's
is a
one
whole
thing,
other
one
story.
thing too.
Right.
You know, that
Yes,
happened
let's talk
2
about
years ago, and a lot of home care agencies stood back and stepped out of the arena when that happened. We
Yeah.
did not.
Okay.
We still saw patients every day.
You
we
ran
saw,
to the fire, man.
Mhm.
Good for you.
We saw patients that were positive with COVID. We were in our
Full PPE.
our beekeeper suit as
Yep.
we would go into their home.
Yeah.
But that's something that we didn't, and I think that really shows how our staff cares.
Yeah.
They
Sure.
weren't, "Oh no, please don't send me there."
Yeah.
It was, "Let's go take care of this patient and get them better."
There's
Yeah.
a need.
Yes.
Well, yeah. I mean, if anything in the world, it's you get down with COVID, especially if you're a little older, compromised, something like that. I mean, you need help,
Right.
Right.
and you pray that people aren't running from you.
Right.
Well, and
That's
plus
so
too,
sad.
And
there were so many patients during that time that may have had an exacerbation of their congestive heart failure that were told, "Do not come to the hospital."
right.
So then we had to go into full treatment mode in the home.
Yes.
Increase their visits. Maybe we saw them weekly, but we went 3 times a week until we saw the
Yeah.
fluid, So the doctors really used us a lot. We would be the FaceTime person
Yeah.
for the
Right.
video calls for
We
the
did
doctors.
lots of telehealth visits
Yes.
with physicians and patients.
Okay.
So we were in the home lots doing
Mhm.
that. Another thing, Missy, I'm glad you actually mentioned COVID. That's one of the things I wanted to mention. Some people are afraid to have people come into the home. So what we do at our agency is our staff, every single staff member has to monitor themselves every single morning before they leave the house.
Okay.
We have a COVID screening that we do. They take their temperature. We have protocols put in place. If there's any illness, any fever, anything that they don't go into the home. They also wear masks. We've worn masks the entire time into the home. So we have infection control policies and things that we have done all along to help prevent us bringing in anything into the home to the patient. So
Sure.
we're very safe and try to use every precaution that we can. So,
Well, and that's awesome to know because again, that's you guys caring.
yeah.
Yeah, for sure.
So
Awesome.
what else?
Joint commission.
Joint commission, yes. You want
Go
to
right
talk
ahead.
about that? Okay,
Go
so we just had our joint commission survey recently, as in last Thursday and Friday. So for those of you who don't know what joint commission is, it is the quality accrediting body for our agency. So basically what that means is they tell us if we're doing what we're supposed to be doing. So they come every 3 years and they come in and they come in unannounced, so you don't know when they're showing up.
Oh.
So
Surprise.
And it was.
it was a surprise.
Oh, no.
I pulled up and I look over and I see this lady that I don't know with this little black suitcase thing that she's carrying, and I'm like,
no.
I wonder who that lady is. So she walks in and of course I had just pulled in and I'm right behind her and I'm like, hello, may I help you? And she's like, I'm so-and-so with Joint Commission. And I'm like, you fill out your COVID screening first. You're not allowed to go anywhere because that's our protocol. And
Put your mask on.
Put your mask on, exactly. So, but she was there for 2 days. And we had the conference room just full of all of our binders, our quality binders, our emergency preparedness, our policies and procedures, chart review. They actually went out with Missy and one of our nurses, Denise, and did home visits because they want to see, what are you doing in the home? We want to see
Are your patients happy?
Are your patients happy? They ask the patients questions. They look through their books. They look through all the documentation. So that was 2 full days, and we are so excited. We did an amazing job. We've worked really, really hard all along to make sure that we have been prepared for this. And a couple of the things that really stand out to me that the surveyor said was, your agency is light years above most agencies. Like just those words, gave me chills.
That's so awesome.
And she said you should be very proud, and it is very evident that you take pride. Every single person on your team takes pride in what they do. So coming from a Joint Commission surveyor that surveys, thousands of agencies all over and she travels all over the world.
She's in Hawaii,
she's in Hawaii, California.
So she's just not little Southern Ohio girl.
So
she was from Michigan.
She was from Michigan, so we had to give her a little bit of a hard time about that.
Say.
Yes.
Yeah, go Bucks. It was great. So we are very, very proud of that and have worked very hard. So kudos to my team for sure for that.
And I want this out there. Everyone that knows my husband, Chad, he thinks I'm a horrible driver. What did you say about my driving?
Yes, Missy actually drove the surveyor around because I have no sense of direction, and I was afraid that I would get her lost, and that would not be good for a survey. We can't even get to the patient's house because the administrator CEO doesn't even know how to get there. Yes. So Missy said, don't let Laura drive. So Missy drove her around, and she said Missy was and she actually taxied her around because she wasn't even allowed to sit beside her. She had to sit in the back seat.
She had to sit in the back seat because of COVID.
Yes. So, yeah. But they got there and got back, and she actually complimented Missy's driving and said that she did a very good job. So, yes.
So my husband said, well, she must have been asleep with every other person that she's been riding with.
Yeah. So we have a good time as
you
well.
You tell him to just zip it.
Exactly.
Right.
I know.
Yes.
Yes.
Because you have written proof.
One time I told him to shut up and speak. So, yeah, there you go. Yeah.
Oh, goodness.
But we absolutely take pride in every encounter that we have with patients in the community, with doctors' offices when we call them. We truly are an agency that cares.
Yeah.
And we love our patients.
Yeah.
I wish I would have known about these type of resources with my grandparents. I just didn't know that they existed.
Sure.
And so to be in this, line of work, and to realize that those resources are out there and people just may not be aware of it. So if you're not sure if you qualify, give us a call and, we'll come out and see, because I think it
Correct.
helps a lot of people, and a lot of people could be helped that maybe just aren't aware that those resources are available.
And you're exactly right. And it can be anything from, as you said, like helping them sort out their medication, to if you just need help getting in and out of the shower.
Yes,
Just
we do
day-to-day
provide
tasks that
Right.
that means everything to somebody.
Exactly. We provide home health aid services as well. So we have a non-skilled division that we work with Passport and the Department of Medicaid and Department of Aging. And we also do private pay for home health aid services to come into the home to help with just those types of things. So if you need help with personal care, you need help with homemaking, such as, running errands, you need help with your laundry, making your bed, sweeping, dusting, fixing meals, things like that. We also provide those services as well and have a phenomenal team that helps in those areas as well. So
Yeah, and I think that's it's not too mundane of a task for you all to help.
Right.
The things that we all take for granted that we do every day, whether it be carry a laundry basket down the hallway, some people can't do that.
Right.
And so that's where you come in as well. And I was reading something on your flyer that I think is so very important, and that is respite stays for caregivers. And caregivers
get tired.
get the shaft more than, and I'm not complaining, I'm just saying that's, when you're caring for someone and you need a break, you most
You
of
need a
them
break.
don't ask.
Absolutely.
Right.
Absolutely. So we offer
They
those
don't feel like
services
they
as
can.
well. If the caregiver, that's in the home 24/7 taking care of somebody, they need breaks as well. So we offer, like she said, we offer the respite services as well to give you a little break, let you have a little time, for you. If it's a day, if it's 2 days, if it's a week, whatever, we can help provide those services as well in the home.
You can go visit your child,
Yep.
or you
Mhm.
can
Go on vacation.
go to the
You can-
movies. I mean,
Right.
like whatever.
Exactly.
Go get your hair done.
Yeah.
Yes. Go get your nails done, just to have a little bit of time away.
A little break. So that's something
Yeah.
else that a lot of people don't think of, I don't think, because when people are caregivers, they're pretty selfless, and sometimes they just won't take that time for them.
Yeah. Exactly.
So that's a good one.
Exactly. Yeah.
All right. So get rid of your rugs.
Yes. Yes. Get rid of your throw rugs.
Like
They're-
we're joking about that, but I think that's a huge
Yes,
thing.
yes.
It really is.
Don't have your oxygen tubing going from your bedroom to the kitchen.
Yes. Yes. You really watch those types
Because
of
your home
things.
care nurse might trip on it.
Yeah.
Not that anyone has.
Not that that's ever
Yes.
happened or anything.
Make sure you have non-slip in the bathtub. Have the, what is that called? The non-slip.
The non
Like a mat.
Like the mats. Yes. In the bathtub. Shower chairs.
And if you
Those
have a
handles
lifeline,
are
wear
easy
it.
too.
Yes.
Oh, a lifeline,
Oh,
wear it.
yes.
Keep it charged.
Yes.
We have patients that have those, and we look for those when we come in, and we're like, where's your life alert? Oh, it's in my bedroom. But what if you fall in your kitchen? What are you going to do? So wear those life alerts. Those are very important.
And we can help get those set up as well.
Yes.
We can
Okay.
make contacts if we, when we go in, we do a home safety evaluation. So the throw rugs, the cords going across, if there are areas on the carpet that are frayed that they may trip on, if they need the little reacher thing to pick stuff up off the floor,
Sure.
we look for stuff like that. That's our specialty. That's one of the things that we do. We want them to be safe at home for as long as they can be there.
Yes.
Yeah, our therapy group, and I'm just going to read some of this equipment because I don't even know what some of this is, but they can bring in equipment into the home, such as the East ultrasounds, weights, TheraBand, equipment to help increase dexterity. They can help improve, your, what they will do is they will actually, if you have a patient that needs assistance with getting in and out of the shower, like they don't come in and just give you exercises to do. Like our therapist take the patients to the shower, and they're working with them to get in and out of the shower. They're working with them to safely do car transfers. So when I say that, we have one right now that we're working with the family, and they're setting up a visit with our therapist. So the family's going to be there at the same time. And our goal is this patient wants to be able to get out of her home to go to different things. She wants to go with her family, and she's just not safe right now.
Right.
So our therapist is working with her and her family to do an actual car transfer on a Saturday, because that's the only time that the family can be there.
Okay.
So that's when our therapist is going. They're going on Saturday. So, we have worked with the VA to get ramps built, bathroom modifications. So it's safe for them to get in and out of their bathroom.
That's such a big deal.
Yes. So,
They will even work with patients folding laundry.
Yes.
To get them back and doing stuff like that. Cooking a meal.
Yeah.
Uh-huh.
Making for sure that they can do that safely and properly. So
our occupational therapist, if we have a patient that we've had several patients that have had very poor vision, and our occupational therapist has went in the home and they have made modifications like in the kitchen, so it's safe for them they can touch and feel certain things rather than being able to have to see it.
Makes
so
sense.
to make it safe so they don't catch their house on fire. Working with their stove and their oven and things like that. So there's so many different things.
I have one patient that she can never remember when she's walking with her walker to stay in the center of her walker. And every time, the walker will be way out here and she'll be 3 miles away.
Oh, no.
So when I went to see her the other day, inside her walker was this huge piece of paper that said, "Step inside the walker." That the occupational therapist had put on there to remind her. And of course, I always joke to her about that. And she said, "I know I should be inside the walker at all times, except for when I'm getting ready to sit down."
Yeah. Yeah.
So yeah,
That's good.
I mean, we do
what we have to
things.
do.
Yeah.
I've made cheat sheets. I've had cheat sheets for insulin. Somebody that was a new diabetic, and they were having to do different types of insulin at different times of the day.
That is so intimidating.
So, we've made big cheat sheets and hung them on their area where their medicine is, so they can
That's
then
so cool.
mark it off. Okay, I took that one. What's next? So we do what we have to do to make sure that that the patients get the care that they need in the home. So
And we allow the patient to help with that plan of care. We don't just go in and say, "You're going to do this, this, and this."
Okay.
We'll sit down with the patient and say, "Okay, we need to work on this. What is the way that you want to get to that end result?"
And those patients really appreciate being part of that decision making. They feel like that gives them some authority to step up and be a participant in that plan of care.
And you're exactly right, because if you're to the point where you need someone to come in and help you in your home, you're feeling like a child anyway.
Right.
You're feeling not independent. You're and to be able to have control over your own life, I think would be a huge deal to people.
Yes.
Yeah, we ask them, that's one of the first things we ask them is, what are your goals for us being in here? So, it's not us, like Missy said, us coming in and just dictating it all. It's like, what are your goals and how can we help you get to what your goals are?
We had a patient that had 2 young children, and his goal was to be able to walk them to the bus stop. That was his goal.
That's so cool.
Yeah.
So that's what we worked on. And he was super excited when he was able to do that. But it's when you allow the patient and meet them where they are, you're going to have excellent outcomes all the way around. Because when you show the patient that they're the important one in the encounter, they're going to want to learn, they're going to want to cooperate, and they're going to feel like, hey, this is about me, not about you and what your company wants.
I think that's so great.
Yeah. And we let them know from the beginning, because sometimes they get nervous when we come in too, because they think, oh my goodness, they're coming in to try to get me out of my home.
Right.
They're going to put me in a nursing home. Is this what they're here for?
Yeah. I can see that.
So we want to make sure, at our very first visit when we go, we let them know we're here to help you. Our goal is to keep you in your home. So that way they can kind of let their guard down, because sometimes they'll tell you they can do things that they really can't do because they're scared to tell you they can't do them because they're afraid, oh, they're going to put me in a nursing home.
They're going to take me away.
They're going to take my car away, or take everything, my last, what I have away. So we let them know right up front that that is not our goal. Our goal is to keep them in the home and to get them back to their baseline and get them to the best that they can be and be in that home, but to do it safely.
Yeah, and I mean, that's your goal, is to help them help themselves.
Mhm.
I mean, that's the total goal.
Exactly.
So
Yeah.
we'll get
we
it done.
had a story that one of our nurses, who's phenomenal, she's just has a heart as big as can be, and so we had a physician that contacted us and wanted us to go out and do an assessment, and the patient was very reluctant, and so Denise is just amazing and said, just let me come in, and so she knocked on the door. And the lady just peeked her head out. So Denise, told her why she was there and had already set it up. And she was having some reluctance. And so when she finally opened the door, she said, I'm really sorry, I don't have a chair for you to sit in. And she said, well, where do you sit? And she said, I sit on the floor. She said, well, then that's where I'll sit. And so she sat right on the floor with her. So not only did she make a difference in her medically, but she also bonded with her as a friend and really helped to get her some resources. So those are the kind of things that I think set WISE apart from other agencies, is they are really able to make that family connection.
Yeah.
Yeah.
Love that.
We meet our patients where they are. They don't ever have to be embarrassed about
Right.
us coming into their home. We don't judge anybody. We've been into some homes and we've helped, just as much as we can. So don't ever be embarrassed about, us coming in to help you, because that's the last thing that we want.
Right.
Yeah.
So we understand.
That defeats the purpose.
It does.
Like,
It does.
the whole
Exactly.
point is to help you.
To
Yeah.
help you.
Yeah.
Exactly.
Yeah. What
Yeah.
resources can we help provide you with?
And a
Right.
lot of
Sure.
times we are their only family.
Yeah.
Mhm.
I have had a patient that was like 90 years old. Their youngest child was 70. The child
Mhm.
passes away,
Yeah.
and we were all that she had.
Yeah.
Mhm.
And we don't take that lightly.
Right.
We most definitely treat every patient just like we would want to be treated, or how we would treat our own grandmother.
Absolutely.
And, I never leave my patients' homes without saying I love you and give them a hug, just because I do. And they may not get a hug except from us.
Mhm.
Sure.
And everybody needs a hug, even during COVID.
Right.
Correct.
I can't tell you how many times we've cried with
Mhm.
patients, how many times we've laughed with patients. So we, when Missy says that they are our family, they truly are.
I love
We
that.
both actually were just at a viewing for a patient that we had not even, it's been several years
Mhm.
ago, and Missy and I both took care of her several years ago, but she had such an impact on our lives that it was important for
Aw.
us to be able to go, and it was wonderful because we hadn't seen her family in what,
Probably.
7 years.
Mhm.
And the second we walked in, I said, "Do you know who I am?" And this lady's sister said, "I'll never forget who you are." She's like, "You were my nurse,"
Yeah.
Aw.
So
Because
it's
we
like,
took care of the lady
we
that
took-
passed away and her
and her
sister.
sister.
Aw.
Yes,
And she did the same thing to me. I
Yeah.
thought, there's no way she'll
they'll remember
me.
who we are.
And she got her little walker and she
Yeah,
walked
came
over there
over.
to me and she said, Missy, you were my home care nurse.
Mhm.
Oh.
And she said, you and that other girl were only the two I would let come to my
Yeah.
house. Because that's how that's how our patients are. We make such a connection.
Yes,
Sometimes they will call and say, if Denise can't be here, I don't want anyone else to come.
right.
Aw.
Yeah.
And we still offer,
Yes,
because we don't want them to not have a visit. But we also go with their wishes if they don't want someone else
Right.
there. But I mean, we do. We make a true connection. We have a group of nurses in Pike County right now that take care of a lot of developmentally delayed clients.
yes.
And I have been able to go out and meet those patients, and it's just phenomenal. They go in twice a day, give these patients their medicines. They will take them dinner. They will play cornhole with them.
Aw.
It's just, we're not just a company
Mhm.
wanting business.
hmm
We are a company that cares.
Absolutely,
I
absolutely.
love that.
Yeah.
So
Yeah.
good. And that makes a huge difference.
It
So
does.
thank you for being awesome.
Well,
thank you. Thank you.
All right. So, Lisa, since you will be the one that people talk to
Yes.
when they call for, again, a free evaluation, right?
Right.
Like,
Correct.
That's right.
you're not out anything. If you have questions or whatever, you call. And how do they get a hold of you?
They can call me at the office at 740-775-4108, extension 205, or you can email me at lzink@wisemedicalstaffing.com.
Easy enough.
Yep.
So, and if you can't remember any of that, just Google it.
Just
And I
Yes,
think
we
James
do have
is
a
putting
website.
the
Perfect.
I think James will put the link.
And
up
you can
there.
also
toll-free number.
reach out.
Mhm.
All three of us are on Facebook.
Right.
Sometimes
Sure.
we'll get private messages on Facebook. Hey, I have a question. Can you call me? And we're perfectly fine with that.
Yeah.
We
Or hey,
won't-
I have your dog. Do you want her
Yes,
back?
exactly.
That's right. That's how most communications go.
We also do have a Facebook page, so Wise Medical Home Health. So if you want to go on Facebook and like our page and share it, we would appreciate that as well. And we have you want to-
A toll-free number is 877-207-7060, and the website is wisemedicalstaffing.com.
There you go. And that is awesome. And call these girls. They will come out. They will assess you or your home for free. And then we'll go from there.
Right.
Yes.
Absolutely.
And again, there's nothing too mundane that if you just need help folding laundry or getting in and out of the shower, that's okay.
Yep.
That's what you're there for.
Absolutely.
Or on up to
Yep.
the sky's the limit.
Exactly.
Yes, we love challenges.
We love challenges. Yes.
There you go. Love that. All right. Well, girls, is there anything else you would like to tell our viewers while you're here?
Just thank you. Thank you for your time. We look forward to from hearing from you guys as well, and would
Yes.
love to be able to help provide services for anyone in their home. Just let us know.
And we also have patients that have agreed to talk to patients to,
Yes.
tell them how wonderful we are.
Oh, okay.
So, right.
Yep.
So if you
So word of mouth thing.
word of mouth,
Yeah.
if you guys have something and you want to talk to us, you want to talk to a patient, we can set that up and go from there.
Very good.
Perfect.
Love that. All right. Well, girls, we'll let you get out of here for the day and get back to treating those folks.
Yes.
That's right.
Thank you
Yes,
so much.
Jennifer.
of
Thank
course.
you.
Thank you for coming in. We appreciate it. Come back and see us anytime.
All right.